You heard yesterday Surgeon General Richard Cremona say that the advice he got was when he goes to Washington, D.C., to take a dog because it'll be the only friend he has. And then he topped it by saying, I've learned to take 2 dogs because after 10 years, one of the dogs turned on me. So you realize how it can harden you. But there's a man that I've met, there's a man that I'm so grateful that's been serving our country for decades, that throughout decades of service as a senator, the chairman of the Health Committee, Health, Education, Labor Committee, has never gotten hardened, has always tried to find what's the right thing to do for people. And to no surprise, when we went to Senator Harkin and told him about the problem that we're having in our country and the world, he immediately said, I want to do something about it. Let's hold a hearing about this. Senate hearing, had it, brought attention to it. Hopefully, before he leaves, he's going to help his colleagues introduce some worthwhile bills to keep it going even after he decides to go to something different. Senator Harkin, we're proud to have you as our senator. We're proud to have you as someone that we can call people's people. Thank you so much. Please come on up and accept your award. And thank you. Now, I have asked Senator Harkin to not just say a couple of words. We've asked him to talk to us. So if he's going to talk a little bit, don't think he just wants to. It's because I've asked him to. So please, Senator Harkin, I'm going to leave here.
Joe, I've been around a long time. I got to tell you, they want to hear me or Alison Krauss. Hey, there's not even a debate on that one, Joe.
We can't wait for Alison Krauss, but we've been waiting for you, Senator. Please.
Joe, thank you very much, and thank you all very much for this. One of my favorite Americans was Will Rogers. Will Rogers, after World War I ended, there was a big parade in Washington to honor the doughboys of World War I. It was in the summer, after the armistice had been signed in November. And that next summer, there was a big parade in Washington. It was one of those very hot, humid days in Washington, 100 degrees, 100% humidity. And they had these poor guys marching down Pennsylvania Avenue with their uniforms and their rifles. And in the stands sat all of the generals and the admirals and the politicians watching the troops march by. And troops were fainting, it was so hot. Will Rogers observed this. And he said, it seems to me, he said, that if you really wanted to honor the troops, you'd let the troops sit in the stands and make the politicians and generals and admirals march by. Which is just my way of saying that I appreciate this award. But if I had my druthers, I'd be there and you'd be here, because you're the ones who are really doing the work, day in and day out, to make sure that we can change a system that for too long has ignored the suffering of so many patients. When every medical student goes to college, one of the first things they learn, of course, is the Hippocratic Oath, which succinctly says basically do no harm. But quite frankly, in so many hospitals around the country, we've been doing a lot of harm for so long, and it's time to bring this to an end. So when I met Joe a few years ago, and then he started this movement, I couldn't be here last year for the first year, but I did want to be here this year to again thank you, but to thank Joe Kiani for his leadership and for his drive. Now, some people say that by trying to get to zero by 2020 is probably too unrealistic, maybe too high a goal. But I learned a long time ago that when Joe Kiani sends his mind to do something big, don't bet against him. Because so I have every confidence that with Joe as your leader, as our leader, with his passion and his determination, and with all of you here, that we can meet that goal by 2020. I said once before, I said that Kiani is the kind of guy that if he were the Titanic, the iceberg would have sunk, not the ship. So I also want to pay my respects both to President Clinton, whom you've heard earlier, is a longtime friend of mine. I ran against him when we ran for president. I ran for president in 1992. Some of you may have missed that. Quite frankly, I think even my wife may have missed that one, when I think about it. But we have been friends for a long time. And of course, I also want to pay my respects to Senator Barbara Boxer, whom you heard from yesterday, I guess. There's an old saying, you've heard that old saying about a boxer that punches above his weight. Well, Barbara may be very petite, but I can tell you there is no one that I know of in the United States Senate who has fought longer and harder on behalf of women's health issues than Barbara Boxer. And there is no one who speaks more passionately, more intelligently, more forthrightly about what we need to do to protect our environment and to address the issue of global climate change. Those of you from California can be rightly proud of her as your United States Senator. And those of you who are not from California, you can call her your United States Senator also. I've often said, when we take an oath of office, we take an oath of office as a United States Senator. If I wanted to be an Iowa Senator, I would have run for the Iowa Senate. Or if Barbara Boxer wanted to be a California State Senator, she could run for the State Senate. We take our oath of office as a United States Senator. Every vote I cast is equal in weight to Barbara Boxer's. I represent 3 million people. She represents 30 million people. And so we are. We have to pay attention to our constituents and those who elect us. But we have to think about the broader public good for the United States because we are United States Senators, and that's why I say that about Barbara Boxer. She is truly everyone's senator in this country. Well, let me just, I don't mean to give a long address. As I said, we want to listen to Alice Krauss, so do I. But I did want to just say that when I first came to the Senate, I've been in Congress now for 40 years, 10 in the House, now 30 in the Senate. And when I first came to the Senate and got on the Health Committee, I began talking about what I considered to be the sort of the missing view of healthcare in America. I started almost 30 years ago saying that in America we don't have a healthcare system, we have a sick care system. If you get sick, you get care, one way or another. And quite frankly, we're very good at it in this country. We are at the best of pharmaceuticals, we are at the best in terms of surgical procedures, in terms of any kind of diagnostics. We are the best in the world. But we are one of the worst in the world when it comes to keeping people healthy in the first place. And as now we're finding out from the patient safety movement, we're one of the worst in making sure that people are safe when they enter those hospital doors. And so I see the patient safety movement as sort of another extension of what I've been talking about for a long time. We've got to be more focused on prevention and wellness, keeping people healthy in the first place. In fact, I remember when I ran for president, I talked about this. I talked about it in terms of your car. If you bought a new car and you never changed the oil, and you never had it tuned up, and you never took care of the engine, it'd last you for a while. Then it would just break down. The engine would seize, and that'd be the end of it. But that's sort of a lot of times what we do with our own bodies. We don't take care of it. We don't make sure that we tune it up. We don't make sure that we eat the right foods and exercise. And then somehow we expect that someone is going to have a pill for us or some procedure that's going to make up for that. And so again, I see the patient safety movement as another way of focusing on prevention and wellness. Let me just close with this. I was very involved with the Affordable Care Act. Now, I wasn't chairman of the committee then, but I was sort of acting chairman because Senator Kennedy was very ill at that time, fighting his cancer. And so I was very involved in it. The one part that I was involved in was Title IV. Title IV of the Affordable Care Act is the prevention and wellness part of it, and I was the author of that. And here's what I wrote as a preamble to that. Quote, if we want to truly reform health care to benefit American families, we need to transition from a system focused primarily on treating the sick to one that helps keep people well throughout their lives. End of quote. Well, now obviously prevention also encompasses efforts to prevent hospital-acquired infections. And there are 4 parts. I don't know if Barbara talked about this yesterday, but if she did, it's worth repeating because you ought to know about this. There's so much misinformation out there about the Affordable Care Act. But I thought it'd be wise for me to at least tell you there are 4 provisions that specifically address what you're about. Number 1, we created the Medicare Hospital Value-Based Purchasing Program. For the first time, a large portion of hospital payments will be based on quality performance. This gives hospitals incentives to prevent infections, readmissions, and other adverse events. Number 2, the law established a Medicare hospital readmissions reduction program. It penalizes hospitals participating in Medicare that have high levels of preventable readmissions, which are often caused by hospital-acquired infections. Third, the law funded a new program, the Partnership for Patients. It's a nationwide public-private partnership that offers support to physicians, nurses, and other clinicians to reduce hospital-acquired infections. And number 4, the law created Community-Based Care Transitions Program, which provides grants to support community-based organizations that work with hospitals to reduce preventable readmissions. I guess the bottom line is I want all of you involved in the patient safety movement to know that you're not alone. Through this legislation, through what we're doing at CDC, and with some other legislation I hope to be introducing this year, Joe, we've talked about that, is that we are also involved in this with you from the federal government side. The one thing I learned from the hearing that Joe testified at in September was this: these mistakes and tragedies are caused by human error, and they can be corrected by human attention. They are entirely avoidable. So with hard work and innovation and investment, we can win this fight and we can meet your goal. So I thank each and every one of you for your commitment to improving patient safety, for the passion that you bring to this great cause. Joe, I thank you personally for your vision and your leadership. And again, I thank you all for this very meaningful award. And as I close out my career in the United States Senate, after 30 years in the Senate and as leading this wonderful committee, I can assure you that with whatever problems we have in this country, people say, well, we got all these problems and everything. We've had problems before. If you read your history, we've had a lot of problems in this country before. We had a time in our history when senators used to pack guns coming into the Senate. That's true. Well, we've gotten through those times. And every time we got through it, we became a stronger and a better country. We are in a trying time right now. But I believe, just as President Clinton said earlier, that if we work together and we understand that progress must continue, and that progress can't just be something that's impersonal, something that is sort of outside of ourselves, that this progress must encompass a human value, a human sensitivity, a feeling that we're all in this together, and that yes, we are our brother's keeper, and that healthcare cannot be some impersonal kind of thing. You know, we're not at this Star Wars kind of thing where you just put an instrument on someone and they're healed. The healing process requires more than just instruments and diagnostics and pharmaceuticals. The healing process also requires us to take care of one another, to make sure that we have policies in place that help keep people healthy in the first place, from the earliest time of our children, maternal and child health care, up through schools, in our workplaces, in our communities. What I want to see is a transformation of our society, a transformation where it's easier to be healthy and harder to be unhealthy. You see, right now it's easy to be unhealthy. It's hard to be healthy. That dynamic ought to change. It ought to be easy to be healthy and harder to be unhealthy. What you're doing in the patient safety movement will make it much easier to be healthy, and I thank you for it.
Thank you very much, Senator Tom Harkin, Chairman of the Health, Education, Labor, and Pension Committee. We are grateful to you. While we're sorry you're going to be retiring in 2 years, we just hope that means you'll have more time to spend with us here. So thank you. Look forward to seeing you again next year, Senator.